Catherine, good afternoon. What can you tell us about the article that you read?
The article Children's Mental Health is about predicting and preventing mental health disorders in our youngsters from as early as 5 years old through 14.
And anything about the article that perhaps surprised you?
I was very surprised by the fact that the article states that there are 15 million children living in the United States with mental health disorders.
Wow. Now, what about the role of the school in helping to diagnose these children?
The NPR video about nurses and school diagnosis, or at least being able to identify when there's a mental health disorder in a student, states that the nurse is on probably the best person to be able to assess and determine whether a student has a mental health disorder. My belief would be that a teacher would be better equipped to make that type of evaluation or prediction based off of the fact that they spend so much time with the students, and a nurse may see a student once a week at the most. So I think it has to be a collaborative effort between teachers and nurses, and I think if a teacher thinks that there might be something going on, then that's a great opportunity to refer that student to the nurse for a second opinion. Our book, according to Burke, states that there's such thing as called an educational self-fulfilling prophecy, and what that means is that students who are having difficulties within the classroom generally get labeled, and those labels stick with the children throughout their educational lives, and they can, whereas if a student is having trouble concentrating, then a teacher could say, that child is a troublemaker, and then they may not be able to encourage that child because they've kind of said, you know what, you're too much trouble. I'm going to focus on the kids who are behaving well.